negotiated with the teacher's medical provider for teachers to be covered for COVID-19 related diseases or illnesses.
All right, that's the Chief Executive Officer of the Teacher Service Commission, Nancy Macharia, speaking about the teachers and how they will be kept safe while in school, but also should they contract the virus, then they will be covered. And that is unique because you can imagine the frontline workers, that is the doctors, fighting for that because apparently they are feeling a bit exposed. Let's take a look at some of the feedback before we dive into the rest of the conversation. This is Rala Avid. You're saying that as long as there's no public participation and involvement of the doctors in management of health protocols in schools, once schools open or reopen, COVID-19 will hit Kenyans very hard. I believe you mean HIT. Then someone else on Twitter, you said the hashtag to use is Debrek. This is Ink Luo. Wow, what a name. Did Magoha consider that some teachers could be having underlying conditions like diabetes, obesity, etc., that could make them vulnerable to contracting COVID-19 from the pupils and students they teach? How will they teach with the masks on? Of course, those teachers that may have other pre-existing conditions, but also learners, some of them do. Then W. Lumwachi says that the government should and must come in and mobilize resources towards protection of our children come January. I mean, it just needs to shelve the BBI referendum money and put it on COVID-19 measures. The government has no choice. So concerns about the BBI, is it about the prioritization by the government? And Henry, 6-7, well, Henry, you said that losing an academic calendar year or even 2 years out of school is seriously better than losing a child. Something is not adding up when the Ministry of Education is insisting to keep the learners in schools, yet doctors at the hospitals are dying in numbers. Already 8 doctors are said to have lost their lives in the month of November to COVID-19. Those are some of your sentiments that you are sharing with us. But let me begin with you, Dr. Njoki, because yes, you hear the Teacher Service Commission saying that we're going to cover you should you contract the virus. But it has been noted in this country that it is pretty expensive to nurse a COVID-19 patient or to access treatment, especially should you contract a severe disease. But also it is expensive to protect yourself. And this morning we've just been talking about the cost of education, I mean the cost of protecting learners and teachers in schools. But how then do we prepare at the family level of that eventuality that you might contract the virus, whether it will be a severe disease or mild disease?
It's a scary conversation, and it's one I think that every family should have. And in the medical fraternity, we are almost convinced that it's not if, it's when. Because the rate at which the infection is spreading, more and more people are contracting the virus, even those who genuinely were not, looking for it, and those who have been protecting themselves. But because it is an aerosol-based virus, you can even get it after entering a room where someone was and you didn't even know they were there and COVID, So it is an important discussion that we all need to have at a family level to see if we have a potential COVID-19 situation, what do we do? What healthcare do we access? Are we able to do home-based care? If we hospitalize, what does that look like? And I like your question because it encourages proactive thinking. Let's not wait until we are faced with that situation, because that will be a problem. And we know that many people are succumbing to the illness because they are presenting to hospital very late. And one of the reasons why they're presenting late is because they're afraid of the cost of care. So they think they're going to manage at home until now it is too late. By the time they're going to hospital, then, they're not able to succumb. So my colleagues are really complaining about late presentation, and we need to be aware of that. And before I go, there was something that Madam Pamela talked about, psychosocial support, which I think I need to weigh in on because it's very important. Again, to be intentional. Our children have been at home 9 months. And they've been exposed. Schools are a heaven of protection for our children. They've done things, they've seen things, even at a personal level. These children are not what they were in March. They've experimented with drugs, they've experimented with pornography, they've done all manner of things. And to now gather these children, to orient them now to be able to go back to education, to to study and to probably even do an exam in March is an uphill task. That needs to be intentional. You have to think about how are we going to gather these children, you see. And again, we cannot leave it to the teachers, because teachers have a job to do, and that is to teach and to manage this difficult curriculum that they want to do. We have to think as a school, how will we manage the psychosocial needs of the children? The parents have to chip in. You know, they've also seen their parents lose their jobs. They've lost parents in COVID-19. They've had a difficult time. So how do we gather these children so that they're successful in their studies? It's an intentional conversation that we need to have.
Right. And Principal Kahi, so two issues here. First, the psychosocial support. I don't know what your experience has been with the boys at Machakos School. Of course, most of them are in the upper scale of, what do you call them, of minors. They could be crossing over to adulthood, but they might be easier to manage. I don't know how that is going, but they may also be rebellious. But also, how are you preparing them for that eventuality that you might actually get COVID-19? I know you have the sanatorium with this, or is it a health facility in your school, but they may require hospitalization. How are you having that conversation to prepare not just the students, but also the parents?
Thank you very much. First of all, I would want to state in my edition, I'm not blaming anybody, and I would not blame the Ministry of Education.
Right. Sorry, Principal Kahi.
Having said that, yes?
Please try not to move. We're losing your audio. Just be a bit stable so that we can hear you clearly.
Thank you.
Yes, go ahead.
I was just saying that I think I participate and I fully understand, so I can't blame them. But I must raise concerns where other players must come in to support the ministry, to support the teachers. First of all, I want to appreciate the CEO TSC for her remarks yesterday that the teachers will be covered in COVID-19 cases. That is a very positive move, very reassuring, and we feel safe from there. I only hope that the players, the service providers, will follow suit and not toss the teachers between the NHIF and themselves. Secondly, we heard recently that NHIF was not going to handle COVID-19 cases. We have students coming to school, and they are also under what we call the EduAfia. This one should come out very clearly. Are they saying that the students will not be handled should they have those cases? This has not come out, and before January, we need to have a very clear pathway on how this will be handled. Now, coming to the issues of the psychosocial support, at school level, yes, we have the guiding and counseling departments that have been trying to deal with the students. When the Form 4's candidate classes arrived, we took about 1 week trying to bring them back into school and share. And on the good side, the facility and the medical officers we have in school also came in to help in making the children, understanding them, assisting them get back to school. But it was not easy because a majority of the students, when they are out there, they are picking up some behavior that is not consistent with what the schools expect. And therefore, we are looking forward to a bigger challenge when now we shall have many more. Listening to my colleagues, there are some students who have not come back to school, but they are out there. They are not ready to come back because having been put out for a given number of months, they have felt they don't need to get back to school. And therefore, the fear is if we continue also keeping them too long, then we are going to lose many of them. So, counseling have to be put in place. Schools, I'm sure that one through their departments, they are preparing, but they will need also reinforcement from other players who will come in and help them.
Right. Oh, okay, all right, Principal Kahi. But Dr. Pamela Odhiambo, as we wind up, so in Migori County, I see you have 613 infections. That is as of, I believe it was on Saturday, the 14th of November, 2020. And there will be more cases, obviously, and still the same question, how to prepare to take care of this, because you are a member of parliament, a representative of the people, and many are times that you'll be approached to support people in medical bills. So how does the society in Migori County prepare themselves for that eventuality? Because Dr. Njoki says that it is a question of when, not if, that a family member will contract the virus.
Thank you very much, Sam. It's actually a question of when. I agree with Dr. Njoki totally. And also allow me, as I go there, to appreciate the TSC for thinking of covering the teachers, but allow me to encourage them as well to do more of protection than waiting for the teacher to be infected, then they are covered. I am of the opinion that if the TSC can do anything to make sure that these teachers have the protection, to me, that would be better than waiting for them to be sick and then they are covered. But I want to appreciate the fact that TSC is willing to see to it that those teachers who are affected are actually covered and they can get their treatment. That is kudos to TSC. At the same time, there was somebody that raised something that I know you have not talked about it, but I would like to emphasize it, that as the ministry considered any teachers who are of having any persisting existing conditions, I think even at the onset of calling teachers back to school, and this we discussed with the ministry at one of our parliamentary sittings, we were asking them, what about those teachers who are ill? What about those teachers who are old? I think it is out there, and even according to the presidential directive and owing to the guidelines given by the health sector, the teachers who are, say, of a certain age and those who are sick, I think they should be exempted from that full blast interaction with the students, and therefore, given the many teachers that we have out there, including interns and people who have no jobs, I believe TSC can find a way of assisting these teachers, even if they are to prepare their lessons at home and somebody else has to deliver these lessons. We need to think about them and we need to take care of them so that we don't necessarily expose them. As for the preparation of the society, in Migori County, to be honest with you, let me tell you that people are still apparently seemingly living in some sort of trial, denial. This disease is not here with us. But what we have constantly said is that people need to take responsibility and try to protect themselves as they protect others and as we protect one another against this infection. Yesterday, I was in some very long telephone conversation with the county commissioner of Migori County, and we were expressing the concern at the issues. You know, the other day the president spoke and said that there should be no gatherings, and unless it is a town kind of hall sitting where restriction is there of how many people are attending and social distancing. Yes. I was asking him, what are you doing about funerals? What are you doing about any other gatherings? And he is concerned. And I'm also concerned as the representative of the people, and I would like to sound a warning. Let our people take control. Let us obey some of these simple instructions that we are being told. There is no need in trying to live like the virus doesn't know you, and then the following minute you are dying. Those increased cases, the 600 that you are talking about, actually was part of my genesis of raising that concern with the commissioner. Because we need to know that preparation of healthcare wise, many of these people do not even have the simple NHIF card. And so in the event that they feel sick, if nobody else paid for their bill, they will surely die. And it is important that everyone knows that caring for this infection, the patient with this infection, is very, very expensive. Even the idea of wearing a mask, some of the family are struggling. We have had to buy masks to give the public for free. And the government has had to make sure that the prices are lower. So I think level of preparation for individuals to take care of this kind of medical care,
all right.
No, it is not there as to what I can talk about. But my urge would be to encourage them to do the right thing, behave well, and stop exposing ourselves to this disease unnecessarily.
All right, Dr. Pamela Odhiambo, we hear you loud and clear. Engineer Lazaro Kanyamboki is saying that the roadmap to school is welcome. Report from the WHO indicated that COVID might be with us for quite a long time. We must learn to manage how to live with it in our institutions, and the government should only deal with predators, that is the corrupt officials who are taking advantage of the situation at the moment. Do you have some more feedback? And Peter Murgo says that great discussion this morning on education. Indeed, they support the approach on collective responsibility to combat the effects of the pandemic holistically. Thank you so much, Dr. Pamela Odhiambo, Principal in Temulikahi, the Chairperson of the Kenya Secondary Schools Health Association, and Dr. Njoki Fernandez, an expert in health and safety, and has been very instrumental in advising some of the schools on what to do to protect their learners. The conversation continues, but primarily take care of yourself, take care of your household, but also take care of your colleagues by doing what you must do. Social distance, wash your hands, put on your face mask for the sake of safety. After the break, we have Comedy Tuesday with Willis Raburu, who is already in studio and trying to say a few things, but you cannot hear him. He'll have his time after this break.